So, hi, Kevin, how are you? I'm going to do some stretches today and then do some exercises on you today. The goal of the exercises for the first part is self-stretches and the strengthening exercises are really just for you to get some stuff into the home so that you can get these particular muscles, one more flexible and another a little bit stronger. The goal of it really is always to do it safely. So then one of the things we're watching for all the time is we want to have room to do these in a way that's safe. So for example here, I would take this out of the way and try and get some, make sure you have clarity so that nothing, you can't trip over anything. And then when you're doing it, everything has to feel safe and comfortable. Okay? So we'll start with this stretch and we'll do it for a small muscle in the lower body. And it's called tibialis posterior. So, but before we do that, we'll do a warm-up. The warm-up will be just for the lower body, so we'll just get you to run on the squat for 10 seconds. Ready? Thank you. So that's warmed up. You want to warm up before you do it, because you get a better result. With the stretch, you get more flexibility, and with a strength exercise, you tend to get warmed up and it feels better. So if we look at tib posterior, this is a muscle in the lower leg. So what it does is it does that. It moves into inversion and plantar flexion. So we want to do the opposite of that. A good way to do that is just hold in this position. Take this hand and then bring that out. Maybe this hand's better. Bring it out. So what we're doing is trying to take that into the opposite of what it does. So it comes up and then out. Okay? You want to try that? Bring it lower, so you want to be closer to the heel. That's it. And then turning. That's it. Good. That's the next position. You feel stretch with it. Good. So you're coming up, and you're coming out, and that's what you want. You hold that for 15 seconds. Okay. So now you'll do that. We'll get you to do that once a day. Maybe do it 15 seconds times 3. One set, once a day, 2 weeks, and then we'll reassess in 2 weeks. Okay. Any questions? So that's the self-stretch for tib anterior, tib posterior. Now we'll do a strengthening, isometric strengthening for mid-trap. So this one you can do on your bed or on the floor at home. I'll demonstrate at the table here, but then you'll get a sense of how you do it on your own. So here you notice that the area is safe. We're going to do upper body here, so let's do a quick warm-up. Let's do arm circle. It's nice and good, right? So we're going to get the muscle in this area. Okay. So I'll just demonstrate it first. Then come up. Put my thumb up, and I'm going to come up from this position and hold that position. Hold it for 10 seconds. And then take a rest. You want to try it? Okay, so you're going to need to bring your arms out. I want them straight out. Thumbs up. And come up. Hold that position. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Rest. Then you take a 30-second rest and then do another one. Okay. We'll do 10 of those. That's great. So we'll do a set of 10 of those. That's all okay. The goal of that is to increase the strength. That's the posture muscle. So it increases the strength so that when we get tired and working at a desk, our muscles will up. So you'll do that. We'll do that once a day with a set of 10-second hold with 30-second rest. We'll do that 10 times once a day for 2 weeks, and then reset. Okay. But at any point you feel uncomfortable or hurt in any way, you don't want to hurt, but you do want to feel tired and hurt. or any engagement of those muscles. It might feel different. Okay. So that's the isometric. We'll do isotonic strengthening for deltoid muscles. So I'll use a band for this one. Or you can use a dumbbell. But for this, I'll use a band. So the posture for the deltoid, we want to, again, so we'll actually our movement, so we want to open that up. Go ahead. Open it up. 5 seconds. 1, 2, 3, 4, 5. That's great. So we're going to get this part of the muscle. The goal is just to make it stronger, so that when you're lifting things, you're carrying the bag. It's not as, tired as much. So we'll take the TheraBand and step on it. What we want to do with the action is we want to move it back, not straight out. The muscle, part of the muscle does this, where we're trying to get the back part. So move it back. So not totally back like that, but more to the side. Okay, so let's try that. Very good. So what you started with was you created tension on the band before you started. That's great. And so we'll just move that. That's more kind of. So that's good. That's just about right. Yeah, good. Okay. And we'll do that. You can do a set of those as 10. Okay, you do 3 sets of 10 once every second. Take a break when you do this exercise so that you have a day off in between. And that way your muscle recovers. Any questions? Okay, so those are our 3 exercises. So then we'll do a contract, relax on your subscapularis muscle. So then get you lie down. Subscapularis does internal rotation, so we'll try and try external rotation. So it's contract, relax. So we'll get you to take this position. I want your elbow to your side, like that. I want you to relax. And again, take your arm out. So yours is limited here, so we'll see if this actually works for you. So I need you to push your hand in. 1, 2, 3, 4, 5, 6, relax. Do it again. 1, 2, 3, 4, 5, 6, relax. Relax, relax, relax. And again, one more time. 1, 2, 3, 4, 5, 6, relax. Deep breath, let go. So then I'll do the final 15 second stretch. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Great. We got about 20 degrees range of motion there. That's really cool. All right, we'll do one more, and we'll do a passive range of motion of abduction of the plantar humeral joint. So you stay where you are, perfect position. You're not going to do anything to help you. I'm going to do all the work here. And I'm just going to move to a range of motion. It shouldn't feel uncomfortable and stop you that. Okay, so coming through. 1, 2, 3, 4, 5. Right? That's it. Any questions? There's a lot to do. There's a lot of thinking there in terms of getting. So I think it's really important that you get your own routines so you get a sense of what you're moving to next. Like there's so many things that you're trying to demonstrate. It's not just the exercise, but it's the other part that make it all home care, right? So the one action, maybe it's not easy, but it's a quick part. The rest is a lot of talking and creating context for it. All right, great.